Welcome back to CTV Morning Live. Time for our Healthy Living segment. Steve Brown joining us from the Family Physiotherapy Centre. Great to have you once again. And we have Lee McKenzie joining us from Ortho Canada. Great to have you on the show, Lee.
Great, thanks.
So this is another partnership that you've got, or something that you're actually using within the clinics for your patients.
That's right. It's a little step up from the normal tape. It's K-taping, and I'll let Lee explain all about K-taping. But taping is used to enhance the muscle or inhibit the muscle. We use it a lot for pain relief and for testing beforehand if we want to use a brace or anything along those lines. But I won't steal Lee's thunder.
So Lee, give us the rundown. This looks it looks like a really interesting product and a great dynamic behind it.
It is. This is called K-tape for me. It's a German product from K-taping. We've had it for about a year in Canada right now. We train physiotherapists and athletic therapists. This is in particular a retail product that they've made. It's sort of like a pre-cut. There's 8 applications for the body, and it's a gentle form of pain therapy. So better than any sort of Tylenol or anything. People don't want to take any more medications nowadays. So they're finding with the tape, it's has a bit of a lifting action to it.
Can I see it?
Sure. And when we just tear the back,
there's got to be a way to do it. Oh, you got okay. Yeah.
You can actually see there's a stretch to it.
Yeah.
These little wavelength patterns. So when I actually apply it to the skin, it has this lifting action that causes a little bit of space. Just got
so this injury, so we would be pretending that we're dealing with what kind of an injury right now?
So this is an injury, anybody with a chronic knee weakness or a previous injury on the knee joint line, or if you had an acute injury, which means an injury that's happened right away. This is very good for supporting that ligament right there. You have 2 ligaments on the side of your knee, your collateral ligaments, and this is just supporting those ligaments. So it's causing a bit of a lifting action as well, promoting blood flow, reducing swelling, and giving that person extra support in that area.
Okay, you don't want to. Okay, here we go. So there's the other one. You take fully like that?
Yeah, just like that. And then we just do a full stretch on either side. So this is, it'll last 3 to 5 days.
You've really stretched that as you're putting it on.
It's got a very good stretch to it. There's no latex in the tape at all. If anybody has a latex allergy, it's fine. There's a little acrylic in it as well, so if he were to go out for a run after and sweat, it actually causes a warming action. It promotes the tape's effect.
It's not going to start to peel off.
No,
it'll stay on
for 3 to 5 days, depending on the person's skin type and hair.
So we're looking at something that's affecting the knee right now, but could you be looking at it for shoulder pain, back pain? Like, where are you actually looking to place this?
Anywhere where you have pain. As you can see, there's 8 applications here. There's one for the lower back.
All right, so you would have it. And would you learn how to be able to do it and how to put it on yourself?
Exactly. There's good instructions on the inside of each pack describing what the actual tape does associated to that body type. This is for bruising. It actually lifts the bruise out in about 2 to 3 days. And you can wear it for up to 5 days. Even in the shower, you just pat it dry, it stays on. You can swim with it. It's fabulous.
That's really cool. Oh my goodness, look at this, ladies. Are you kidding me?
Menstrual pain.
Are you kidding me? So just over top of the abdomen?
Exactly. The cross in the front there, and then there's one on the back. And actually they found through more like a Chinese acupressure concept that actually reduces the back of the uterus. Yeah. And they can reduce menstrual pain up to 75%.
Because oftentimes you're just looking for someone to put some pressure on your back because it tends to relieve some of the pain in the front. This is awesome. Sorry, this is going missing. Okay. You've got wrist, you've got knee, so you've got a variety of things, and this is something that you could put on in the clinic.
That's
or
right.
You're looking for people to be able to educate themselves and be able to do it themselves. Yeah. This is amazing, and it feels pretty good.
Oh yeah, it feels great.
It's great to see. Now, I'm asking about the colors. Is that just for preference, or is that actually for purpose?
It is a very low percentage purpose. It's based on the study of color called chromatics. And they're finding with the pink, it's basically a warming effect, and the blue is a cooling effect. So you can actually decrease tension on a muscle with the blue and support a muscle that's not really firing correctly and use the pink.
That's amazing. People can find more information where?
At Family Physio.
Family Physio, yeah. All of our physiotherapists are being trained on the K-taping, so they definitely can come in and have a treatment.
Perfect. Really interesting. It's crazy to see where everything goes now in terms of pain relief and to be able to get out and so people can go do the activities they want to do. Just have that extra support. Great to meet you, Lee. Thanks a lot.
Thank you.
We are going to take a short commercial break, by the way, coming up next week on next time that you're on, the Trauma Code. He is an amazing guy, Doug Smith.
He is a very amazing guy. So looking forward to having him on.
Okay, and keep in mind he's recovered from a crazy spinal injury and his fractured neck and his story on how he's recovered and the life that he's led since then. So that'll be on our next segment with Steve Brown and Family Physiotherapy Centre. For more information on the K-tape, you can find it too at Family Physio. All right, we're going to take a short commercial break. We're back right after this.